all, this is AGAPE VLOGS back again. Thank you all for the lovely comments you have been posting. And I would like to mention a few names: Rajesh PT, Jitendra Parmar, Sakti Vale, Joyce Edwards, Josna Rose, Pierre Samianto, Kamachi Tankavelu, Abigail Osai, Angelin Samuel, and Charity Bala. Thank you guys. Best of luck for your forthcoming exams. This is continuation of NMC CBT mock test. Questions 41 to 50 of Part 1 Test 4. 41st question. Why is it essential to humidify oxygen used during respiratory therapy? Guys, there are 4 options and you have to follow very closely and keenly. Only then you will be able to pick the right answer. Option A. Oxygen is a very hot gas, so if humidification isn't used, the oxygen will burn the respiratory tract and cause considerable pain for the patient when they breathe. Option B. Oxygen is a dry gas which can cause evaporation of water from the respiratory tract and lead to thickened mucus in the airways, reduction of the movement of cilia, and increased susceptibility to respiratory infection. Option C. Humidification cleans oxygen as it is administered to ensure it is free from any aerobic pathogens before it is inhaled by the patient. Option D. Humidifying oxygen adds hydrogen to it, which makes it easier for oxygen to be absorbed to the blood in the lungs. This means the cells that need it for intracellular function have their needs met in a more timely manner. Here, I don't know how many of y'all have got the answer right. I will explain it very briefly. The question was, why is it essential to humidify oxygen during a respiratory therapy? And the simple reason is that oxygen is a dry gas. So it can cause evaporation of water from the respiratory tract, and it can also lead to thickened mucus in the airways. So you can be more prone to respiratory infections. So that is the reason, and option B is the right answer. 42nd question. Which of the following is not a symptom of impacted earwax? Options are option A, dizziness, option B, dull hearing, option C, reflux cough, and option D, sneezing. Option D, sneezing, is the right answer. Impacted earwax can lead to dizziness as well as dull hearing. So here the question is, which is not a symptom of impacted earwax? First of all, you have to listen to the question very carefully. Okay, I know all of you have got the answer right. So moving on to the next question. After death, who can legally give permission for a patient's body to be donated to medical science? Options are option A, only the patient if they left instructions for this. Option B, the patient's spouse or next of kin. And option C, the patient's GP. And option D, the doctor in charge at the time of death. So you have to think very wisely and get the answer right. Option A, only the patient if they left instructions for this, is the right answer. So moving on to the 44th question. What should be included in your initial assessment of a patient's respiratory status? Options are option A, review the patient's notes and charts to obtain the patient's history. Option B, review the results of routine investigations. Option C, observe the patient's breathing for ease and comfort, rate and pattern. Option D, perform a systematic examination and ask the relatives for the patient's history. Here the right option is option C, that is, observe the patient's breathing for ease and comfort, rate and pattern. This should be included in your initial assessment of your patient's respiratory status. Just kindly note your score so that you can understand where you stand, and these questions in this session are mostly based on respiratory system. Question number 45. What should be included in a prescription for oxygen therapy? Options are option A, you don't need a prescription for oxygen unless in an emergency. Option B, the date it should commence, the doctor's signature and bleep number. Option C, the type of oxygen delivery system, inspired oxygen percentage and duration of the therapy. And option D, you only need a prescription if the patient is going to have home oxygen. So here the right answer is option C, that is, the type of oxygen delivery system, inspired oxygen percentage and duration of the therapy. So these should be included in a prescription for oxygen therapy. Got me? Question number 46. You are caring for a patient with a tracheostomy in situ who requires frequent suctioning. How long should you suction for? Options are option A, if you pre-oxygenate the patient, you can insert the catheter for 45 seconds. Option B, never insert the catheter for longer than 10 to 15 seconds. And option C, monitor the patient's oxygen saturations and suction for 30 seconds. And option D, suction for 50 seconds and send a specimen to the laboratory if the secretions are purulent. Option B, never insert the catheter for longer than 10 to 15 seconds is the right answer. Hope all of you have got it right. Next is a very simple question. Question number 47. What does the term breakthrough pain mean and what type of prescription would you expect for it? Options are option E, a patient who has adequately controlled pain relief with short-lived exacerbation of pain with a prescription that has no regular time of administration of analgesia. Option B, pain on movement which is short-lived with a QDS prescription when necessary. And option C, pain that's intense, unexpected in a location that differs from that previously assessed, needing a review before a prescription is written. And option D, a patient who has adequately controlled pain relief with short-lived exacerbation of pain with a prescription that has 4-hourly frequency of analgesia if necessary. So I told you the question is very easy, but I don't think the answer is that easy. So it's a very tricky in fact. So the right option is option A. How many of you have got it right? Anyways, if you have found it confusing, I'll give you a short note of breakthrough pain. It is nothing but a sudden and brief flare-up of pain from a chronic condition like arthritis or cancer. Even if you have been managing your pain with medication, during this flare-up, the pain becomes severe enough to break through the pain medication you are taking. So you got it? What is breakthrough pain? And with the prescription that has no regular time of administration of analgesia. Well, isn't it clear and simple now? Next question, question number 48. A patient has just returned from theatre following surgery on their left arm. They have a PCA infusion connected, and from the admission you remember that they have poor dexterity with their right hand. They are currently pain-free. What actions would you take? So that's a question. Options are option A, educate the patient's family to push the button when the patient asks for it. Encourage them to tell the nursing staff when they leave the ward so that staff can take over. Option B, routinely offer the patient a bolus and document this clearly. Option C, contact the pain team or the anesthetist to discuss the situation and suggest that the means of delivery are changed. Option D, the patient has paracetamol QDS written up, so this should be adequate pain relief. So what's the right answer? Option C, that is contact the pain team to discuss the situation and suggest that the means of delivery are changed. Got it? So once again, I'll explain to you what is PCA. It is an abbreviation for patient controlled analgesia. So analgesia is a simple word. It means relief of pain. So PCA is a method by which the patient controls the amount of pain medicine, that is analgesia, they receive. And also in PCA, computerized pump called the patient control analgesia pump, which contains a syringe of pain medication as prescribed by a doctor, is connected directly to a patient's intravenous line, and additional doses of medication can be self-administered as needed by having the patient press a button. And in this case you are told that the patient is having poor dexterity in his right hand. So what is dexterity? It is nothing but the ability to perform a difficult action quite quickly and skillfully with the hands. So that's it. So the right option is option C, that is you have to contact the pain team to discuss the situation and suggest that the means of delivery are changed. Question number 49. In which of the following situations might nitrous oxide, that is Entonox, be considered? Options are option A, a wound dressing change for short-term pain relief or the removal of a chest drain for reduction of anxiety. Option B, turning a patient who has bowel obstruction because there is an expectation that they may have pain from pathological fractures. Option C, for pain relief during the insertion of a chest drain for the treatment of a pneumothorax. And option D, for pain relief during a bone dressing for a patient who has had radical head and neck cancer that involved the jaw. Here, The right answer is option A, that is a wound dressing change for short-term pain relief or the removal of a chest drain for reduction of anxiety. So, in these situations, nitrous oxide can be considered. Also brief on nitrous oxide, which is also called as laughing gas or under the brand name Entonox, and it is an inhaled gas used as a pain medication and together with other medications for anesthesia. Common uses include during childbirth, following trauma, and as part of end-of-life care. So here the options are almost similar, and in one it is saying removal of chest drain, and one it's saying insertion of a chest drain. So don't get complexed. You have to go through the options very keenly and you can find the right answer. That is option A, that is a wound dressing change for short-term pain relief or the removal of a chest drain for reduction of anxiety. That's it. I think you have got the answer registered. And before going to the last question, let me ask you to give me a like if you really like this session, and also after the 50th question, please give me your valuable comments in the comment box. Do spare a minute. People don't even have a single minute to spare after going through the session. Only few of you come back with your feedbacks, and that really matters to me, and it has always boosted me and encouraged me to come back with the next session, and so it will be henceforth also. So friends, we have reached the last question of test 4, that is question number 50. What are the key nursing observations needed for patient receiving opioids frequently? Options are option A, respiratory rate, bowel movement record, and pain assessment and score. Option B, checking the patient is not addicted by looking at their blood pressure. Option C, lung function test, oxygen saturations and addiction levels. Option D, daily completion of a Bristol stool chart, urinalysis, and a record of the frequency with which the patient reports breakthrough pain. So what's the right answer? I know each of you know the right answer. It is option A, respiratory rate, bowel movement record, and pain assessment and score are the key nursing observations needed for a patient receiving opioids frequently. So that's it, friends. Thank you all for listening through this session completely. Don't forget to give me your likes and comments. It's very precious for me. And also I wish and pray all of you have a grand success. Do come back after you get the results. Do come back. Some of you come back and tell me that you have passed. The sessions were very helpful, etc. So do come back. Stay healthy, stay safe. Bye bye.